back, wash my hands. Hi, my name is Blake. I'm your nurse practitioner student today with UNC Wilmington. I'm going to be doing a respiratory assessment on you. Is that okay?
Yes.
Awesome. So first thing I'm going to do is look for signs of respiratory distress in an older child / adult. Respiratory distress would present as like dyspnea, tachypnea, accessory muscle use, an IE ratio greater than 1.2. So for example, like prolonged expiration, which I don't see, and then I'm looking for cyanosis. I could also inspect for clubbing on the fingernails as well. And then for an infant, I'd be looking for grunting or nasal flaring. And then I'm going to inspect your anterior chest. And so I'm looking for scars and lesions, which I don't see any of those. And then I'm looking for protrusion of the sternum as well as sinking of the sternum, which could be pigeon chest, funnel chest. And then I'm going to take a look on the back, and I'm going to inspect the back for any lesions or scarring. And I don't see any of that. And then I'm looking for any spinal deformities, which I don't see, which could indicate scoliosis. And then I'm going to measure the AP to transverse diameter. And so I'm going to take a look here. And so say about 32. And then I'll look over here. It's about 32. Awesome. And we'll go here. So about say 16 to 17. So 1 to 2. And an expanding diameter could indicate barrel chest, which is a common sign for COPD. And then I am going to palpate. So I'm gonna have you just face the wall for me. All right. And then what I'm gonna do is around T9, T10, I'm going to touch some of the skin together, place my palms on you and my thumbs. All right, I'm gonna have you take a deep breath. All right. Okay, and another deep breath. All right. And so my thumbs move symmetrically on inspiration and expiration. If they were to move asymmetrically, it could indicate a collapsed lung. And then what I'm gonna do is test for tactile fremitus. So I'm going to put my ulnar on 5 different areas, and I'm gonna have you say the words 99.
99.
All right.
99.
All right.
99.
All right.
99.
All right.
99.
Okay. And so any decreased vibrations could indicate a pneumothorax or emphysema. Any increased vibrations could be fluid, a mass, or pneumonia. And so I am now going to percuss. And so I'm gonna start over here just so I can go in the line. All right, so I'm going to, all right, sounds good. And resonance is good. Any hyperresonance is going to indicate hyperinflation of the lungs, and any dullness could indicate a fluid or mass, some type of pneumonia, something like that. So I'm going to, all right, sounds good. I'm comparing both sides at the same time, and they sound good. They sound clear and resonant. All right, got resonance there as well. And then I'm gonna take a look over here. All right, so we'll start on the back. All right, and so we've got resonance all throughout, which is great. And then the next thing I'm going to do is look for diaphragmatic excursion. So that's going to tell me where the lungs are. And so with diaphragmatic excursion, if it is decreased, there's a chance that there's maybe a tumor, some fluid, or a mass or something pressing against the diaphragm. So I'm going to get my pen. Let's see. I'm going to have you take a deep breath in and hold it. here. All right, you can let go. All right, take some breaths. Okay, and then I'm gonna have you breathe out and hold it. Okay, so about here. All right, and then I'm going to have you do the same thing on the next side. So I'm going to have you take a deep breath in and hold it. And then I'm going to have you let go. All right, and take some breaths. All right, and I'm going to have you exhale and hold it. All right. Okay. And so it's about 3 and about 3. So that looks good. So it can be 3 to 5. The right can be up a little bit more because of the liver. And then, yeah. And then I'm going to do some auscultation. So I'm going to start over here. Take a listen. All right. Just breathe normally with your mouth open. Some nice deep breaths maybe. Okay, and that sounds clear, and I'm listening for any crackles, any rhonchi, any wheezing, any pericardial rub, not pericardial. I'm looking for any friction rubs, and that can indicate pneumonia, or it can indicate any other lung issues. I'm gonna take a listen in the front. Okay. Okay, sounds clear bilaterally. Okay, sounds good. So right and lung, right and left sound good so far. Okay, it sounds clear. And then what I'm gonna do is test for agophony. So I'm gonna listen for, he's gonna say E, and if I hear A, that could be sign there's some fluid consolidation. So I'm gonna have you say the word E.
E.
Again.
E. 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 E.
Okay, and it sounds good. I don't hear A. And then what I'm gonna do is have you do the whisper test, pectoraliqui, and I'm gonna have you say 1, 2, 3, and I'm gonna have you whisper it. Okay, and there's no increase in the whisper. If there was an increase in the whisper, that would be fluid consolidation as well. And then what I'm gonna do is do bronchophony. So I'm gonna have you say 99 in a normal voice.
99, 99,
In a little deeper voice.
99,
Okay.
99, 99, 99, 99, 99, 99, 99.
Okay. And then so it's not heard. If there was an increase in that sound or 99 was heard throughout, there could be fluid consolidation as well. Sounds good. All right. Thank you.